All right. I want to briefly give a shout out to Taraday. Yeah, Taraday Multi Global, right? I'd like to give a shout out to Taraday Multi Global. I'd like to give a proper shout out to Avail Consult International for their support, for their love. Please let's put our hands together. All right. At this junction, I would like to just go straight to the next agenda. I believe we'll be giving one or two things to, because I want us to go on a quick eat break, but I discovered that you guys are already having a nice time while we are seated and, you know. All right, let's just go straight to the next agenda on our list. We are going to our second panel session, and to do that with me, I would like to call on Dr. Olawale Ogunlana. Please, let's put our hands together for Dr. Olawale. This session is actually called My Doctor and I. You should know what that means. This is an exclusive moment. So please, let's put our hands together again for Dr. Olawale. He's here with us. Dr. Olawale, I don't want to say things that I'm not very conversant with. So I would like to just hit you straight.
Okay.
Yes. I don't know why you're looking at me like that.
I'm looking because of the kind of question.
But it's all good. Don't worry. I'm not going to remove your suit.
No
Yeah, obviously. I'd just like you to briefly just let them know a bit about you. At least let them know who they are with first, so they will be more relaxed to attack you left, right, and center.
Okay. So, good afternoon, sirs and everyone. It's a privilege to be here. My name is Dr. Olawale Ogunlana. I'm a medical doctor. I've been in practice for the past 12 years. A couple of people might know me. I do create content online for health advocacy, and that's just what I do in a nutshell. I'm a part of people might call me or go by my name as a medical influencer or a health influencer, but I tend to see myself more as a health advocate. So, and advocating for good health spans across whether it is men, whether it is women, it's all important. So, and I think advocacy starts from you and I being able to have a conversation on health matters and to take questions that, and I think that's the purpose I'm here, to take questions that any of the men here might have, you know, regarding certain things, certain conditions, and I can just give some context to it. Maybe not answer them directly, but probably just give a context to it. Thank you.
Right. I believe at this junction we are all ready to fire. And please, when you are firing, Doctor, fire small, because Doctor said the way I was looking at him, it's as if this is a conspiracy. All right. So I would like, there's an area, a core area I want us to really drive our point from, because right now I think we should even look at things from, I think integrated health won't be bad.
Okay.
All right. So basically, I just believe all of us here, we are ready for this. If we are ready, I just want to see a wave of hand, please. I want to be sure we are doing this together. All right. So is there anybody that's going to come from the angle of, basically we are looking at integrated care. So you can talk about mental, physical, emotional health. Is there any angle you would like to come from? Is there anybody, anything? The doctor is right here. This session is called My Doctor and I. Now the doctor is yours. So, okay.
Yes, sir.
Chief is speaking. The chief is speaking.
Okay. So my handle is Olawales MD. That's OLAWALESMD on all channels. As Olawale SMD. Some people prefer to put it like that, but it's all together. And definitely, I'm always I publish videos twice a week. On Monday, we have a content that is coming up that men will love the most, and it's about the top 3 things that actually cause erectile dysfunction in men that people do not know. So, and I think that is, should I talk about it here? Yeah. Oh, good, I know. All right, so a lot of people always just feel that when it comes to, I think as men, one of the things that, men are not comfortable talking about, but then also gives them confidence or lacks or takes away their confidence is their sexual health. And sexual health also affects your mental health too. And your mental health affects your sexual health. So let me even start from there. Do you know that if you are not in a good, happy mood, you can't be good in the bed? I know sometimes you notice that when you're with a woman and maybe you had a very stressful day or something did not go according to the plan, what you just realize is that you are not performing as you would ought to perform. It's because your mind or the brain itself is a sex organ. So for you to be able to perform and to be active sexually also depends on the state of your mind. So that's why when we are talking about mental health here, we are not just talking about it from the context of you just being vulnerable. We are also talking about it for you being confident and being in that state of mind that will allow you to perform in the best possible way in things that are, or the things that actually matter to you, with sexual health being one of them. Another thing again that is very important is lifestyle. And for a lot of people, they don't know. I remember I once had a patient that he started complaining that he noticed that his performance in bed has not been good enough. And I asked him that, does he know if he's diabetic? He said, no, he hasn't checked, but he wants to believe that he is okay. So I said, okay, no problem, let's run a few tests and see where the problem is coming from. And of course, we did a glucose check. Lo and behold, he had high blood sugar. And that high blood sugar was already more or less telling to the situation. And a lot of people don't know, but diabetes is a condition that one of the things that it does is to damage those tiny blood vessels. And the thing about sexual health or you being able to perform in bed is a matter of blood flow. If you are going to have a good erection, it's blood flow. A lot of people think it is a muscle. It's not. It is blood flowing into the into the penis that actually guarantees erection. So if blood is not flowing well in a condition like diabetes, where the small blood vessels are damaged, or in a condition where, because diabetes also affects, that's the nerve endings, like the nerve system. Do you understand? So those things that actually make you to sense things on time. It damages all of those things. So those little damages like that can cause big changes. So you being able to maintain a normal glucose level can also help you sexually. And then hypertension too, the same thing. If your heart is not pumping properly, you cannot pump properly in bed. It's just it. So those are some of the things that a lot of people play with it. Now, we are still talking about lifestyle. Smoking too is one of the few things that can actually affect you in bed. You might want to do a little bit of research on that. Smoking and erectile dysfunction. It's all about the same thing. Smoking can affect the blood vessels, the tiny blood vessels, and these blood vessels that allow blood flow. If there's anything I want you to remember in today's conversation as regards sexual health, is that good sex for a man is reliant heavily on blood flow. If blood is not flowing properly, you cannot guarantee a very good performance in the other room. So now that I've opened the floor, let's ask questions, because I know you have questions to ask. Yeah, I know. There will be questions, of course. Yes, sir.
That is a very lively topic, and you can see the reaction of men in the house.
Yes.
My answer is sex a good exercise for the heart?
Direct answer.
Yes.
Yes.
It is. But then there are still other things that need to be done alongside sex for it to be guaranteed, like as a form of exercise. But yes, it is, because of course it allows your heart to pump, it releases, dopamine, activity is going on, but then sex is something that just happens for a few minutes. It's actually recommended that when you are doing anything of a cardiac nature, that is for your heart as an activity, it has to be about 30 minutes, right? So, and we all know that sexual activity, even the best of us will perform 15 minutes, you are done, right? For a round, right? Am I lying? In fact, let me even be very honest and candid with every one of you. An average man ought to perform 7 minutes on average in bed. Anything more than that is like if you want to collect PhD.
You're on your own.
Right?
You're on your own.
Hey, you're on your own. But anything like that. But I understand that, yes, most times the man in us always wants to perform. But that is why I am saying that when it comes to a round of sex, right? Because you can divide it into a couple, take a break, come back again, like that. But an average round of sexual intercourse should last about 7-8 minutes. Maximum, some people who are 20 minutes, right, with foreplay. But when it comes to your heart, to directly answer your question, it has to be cardiac activity that can happen for at least 30 minutes. So that is why walking, right, going to the, making exercise, plank, walking out, squats, going to the gym, lifting, for those that can still partake in such kind of activities, running, can actually help your heart. Sex can, of course, is a good activity, but then it is not the only activity that will be able to guarantee. So it has to be like together, right? So
okay, I understand now. We take other exercises. That is what I learned from that.
Yes,
and that will help the blood to flow to the P. I will leave it there.
Yes, sir. Thank you. You're welcome. All right. Okay, sir. Yes, you sir, you.
Okay, I want to ask 2 questions.
Yes, sir.
Number 1, does the frequency of ejaculation affects fertility?
Okay.
That's 1. And 2, we found that people are at various stages when it comes to libido. When someone's libido is so high, does it have a detrimental effect on that person?
Okay. Okay, so are those the 2 questions?
And if you might permit me,
Yes, sir.
there is this common thing. I've actually heard it from older people. They said when they were young, in order to make sure they get rid of their system from STIs and stuff like that, they usually take antibiotics. And now they are aware that taking antibiotics over time do affect the auditory nerve. I want to know how far through this is.
Okay, I will start with the 3rd question. I wouldn't just say that if you, and I think most of us that grew up in the, for a long time, most of these traditions exist that if you feel you have STI, there are certain drugs that you should mix and take. But I would say that the diagnosis of STI must come as a result of a clinical evaluation. So, and I think that is the big problem that a lot of us make. We just assume, we see a few symptoms, we Google it or ask ChatGPT, and then we feel that it is. Whereas it is not. Sometimes it's not. So sometimes people also even mistake a urinary tract infection for a sexual transmitted infection. So, and they end up taking, what that does is that they now end up taking medication for the wrong reasons. And then they take it, because they are not taking it with the guidance of a health professional, they use it for a long time beyond the time frame. Because even if you are using there are some types of antibiotics, you don't use it for a chronic period. You use it for maximum 14 days and then you stop. right? But then you see that people are using it 2 months, they are still using that same medication because, in quotes, they are treating infection. That is where damages begin to happen. And every drug, and I will say this, every drug has side effects. In fact, I will go forward to say that everything you eat has side effects, right? If you take too much water now, like really, we do a competition, and then maybe I ask daddy there that he should drink a whole bottle of, this dispenser water, right? And I ask him to drink it. Water is good for us, is it not? But if he drinks that amount of water, he can die. And the reason is that it can actually damage the kidneys because they will overload and they will not be able to filter everything, and that overload will cause damage, right? So too much of everything is bad. Moderation is the key, and we doctors today, that is what we preach. We preach moderation in everything. Even in antibiotics and drug use, we still tell you that you need to use it with caution, because they are supposed to be for a particular time, and that is it. So to answer that question directly, if you feel that you have symptoms that are in line with a sexually transmitted infection, maybe you see discharge from the penis, you see you are having itching, you are having pain, during sexual intercourse or during ejaculation or during urination, you can make sure you see a doctor first, right? Have a few tests done, let it be sure what you are actually dealing with. Then from there, you can now know that, okay, do I need to make use of antibiotics or not, right? So that's number one. Number two, you were talking about high libido, right? So I think it's more about understanding who you are. So I don't know, and I will still say back to what I used to say, too much of everything is bad. A high libido can put you at, a risk where you always want to have sex. I strongly believe that for us as men, control is one of the most important superpowers that we can ever have. Yes, we've discussed Stoicism today, but one of the lessons that we could take as men from Stoicism is control, right? So it is very important in cases like that. People with high libido should speak with a therapist. Usually, if I'm to advise, they should speak with a sexual therapist. How do I put this under control? Because it's not everything because any man who has a high libido might have or struggle with control when it comes to sexual urges, right? And that can put them at risk of things that can be damaging to them. So if they cannot control it, it is important to speak with the therapist to see how they can best manage themselves and control themselves as men to be able to put that urges under control. Yes.
About this particular one, that it takes longer. Just as you said, that an average of 7 to 8 minutes is enough.
Okay.
But when you find out that it takes longer, I'm talking about something that is
like delayed ejaculation or delayed.
Not really delayed. Anyway, maybe you are in the best position to choose the most appropriate word. But let me just describe it. When it's more than 30 minutes, and when it is difficult for you to ejaculate,
okay,
before 30 minutes, it has to be more than that. Does it have a detrimental effect also? And you actually advise?
Okay. So what you are saying is that somebody who takes a long time during sex, right? So it takes a long time. There might be underlying issues to things like that, right? So, and then another question that needs to be asked is that, is the erection sustained during that whole time, or the erection is weak? So that is another big question, because if the erection is weak, it might mean that is a classification of erectile dysfunction. So he is unable to achieve erection, maximum pleasure, and then ejaculation. That is probably the reason why something like that is happening. And it takes me back to the beginning of what I said. Chronic conditions like diabetes and hypertension or heart disease can actually be one of the causes of that, right? So definitely there needs to be a check, right? So another thing again to find out is what's the lifestyle of this person. If this person is smoking, I've always spoken to a couple of, especially these young men of today that like to smoke everything that they see. I tell them that one of the places that you will regret that you smoke is in the bedroom. one of the places where you would regret smoking is in the bedroom, because you would not be able to, at some point, you will not be able to perform as you would want to perform. So in a case like that, based on those questions, I think a clinical evaluation would be the best thing in that case, to find out why he's struggling to achieve, sexual pleasure in that time. So that's where I would leave it at that. So normally, if you were to come to me, I would have you run a couple of tests. I will ask more in-depth questions. Do you understand? When did this start? Is this something that is just a very recent development, or is something that has been happening for quite a while, right? So from there, we can be able to establish groundwork for what you need to do. All right, so can you remind me the first question that you asked? The frequency of ejaculation and fertility. Okay, so there is, when you say frequency, can I ask how long?
Let's say having intimacy every day.
Okay.
Can that affect the fertility of the sperm?
No, I think it's, let me put it like this so that I don't go too much out of term.
Do you know why I ask this?
Yes.
Because usually it's like, okay, for a sperm to be mature, it takes some time. But when there is always
active sexual intercourse.
Yeah, does it affect?
Okay, so yes, it does take a couple of days for the sperm to generate other new cells and all that. But you also have to remember that if you are somebody who is healthy, you will definitely have sperm that are healthy, that are in stock, that are ready to be pushed at any point in time. But yes, it might have. In fact, that is why if you're going to do a fertility test, they will tell you not to have sex for about 72 hours before you do the test, right? So yes, it is important. If you are somebody who is planning for fertility, right? Somebody you know that, okay, you are planning to have children, it is better that you have sex that with breaks. So for instance, about 3 times in a week. Usually that is what is medically advised. If you are trying to conceive, right, as a man, how you should have sex should be about 3 times in a week, right? So, and for you, the man, you definitely take breaks in between, right? And that will also allow for new sperm to be created and all that. But then it's also important to say that the quality of sperm is determined by several things, right? The health of the man, the general health of the man himself, his level of testosterone, the level of hormones, and that is the chemicals in the body that are able to produce those things, the health of the reproductive system, the testes, the prostate, the everything, the urethra, everything that has to do with, yes. And then also having good sexual intercourse and ejaculating properly, because there are some men who also may have what we call, their penis structure might not be in anatomical structure. It might be different. So those things might actually really affect fertility too. So those are some of the things that also need to be considered in situations like that. So it is not just, it is a factor, right? The frequency of sex, but that is not the only determining factor for sexual health for somebody who is willing to conceive. I hope that answers your question. Sir, you want to say something? Yes, sir.
Thank you.
Yes,
My name is Dupo Kanye. We just talk about health, how sex contribute to mental health and physical health. But we have situations whereby older men, maybe they are with young women, who say Daadaa and all that. And we've had reports of men dying during intercourse. That means when they think they are coming, they are actually going. So I want to discuss this and what do we watch out for, not to stay alive as men.
All right. That's a very good question. It's like I even came prepared. But I didn't know that I'll be asked these questions, but I think I was ready for them. Okay. So, very good question. Very good question. The reason being that, sorry, I have to stand up. The fact is that, yes, it's very possible that you are coming and you are going at the same time. It is something that we like to, when men are of age, there are certain things you must take care of. Once you are 50 and above, there are certain things I need you to do. Number one, you need to go and check your heart. Your heart is like a battery, right? If there is anything that has been working since the day you were born till the day God calls you, it is your heart. It is your heart. The heart is, when you talk about the single most important organ, right? I would say that with the brain too, because the brain is actually more or less like a control panel, right? That it even directs how your heart should beat, how fast it should beat, and things like that. But you see, the heart is like an engine. The battery is always generating. In fact, there are certain places in your heart that generate electricity, right? So, for somebody who is 50 and above and is sexually active, because that is how we classify them, right? It is not and I need to say this clearly, it is not a bad thing to be in your 50s and 60s and still be having good sex. Okay? I think it should also be something that it should be practiced in a healthy manner. So, what will I advise you to do? Number one, have an ECG check. If you are here, if you're in this room and you've not for once subjected yourself to an ECG check, you are wrong. An ECG, an echo, number one, an ECG will show you how electricity is passing through your heart, if it is rightly distributed or if it is wrongly, or something is causing it to not be distributed properly. So in the cases where the person is having a form of heart disease, like for instance, left ventricular hypertrophy, where a side of the heart is now bigger due to the fact that because of hypertension, imagine your blood vessels as a pipe, right? So if the pipes are well relaxed, it is easy for water to flow through. Do you agree? But if the pipes are tiny or squeezed and are tiny, it takes more pressure for water to pass through, right? Yes. That's exactly what your heart does. So if your blood pressure is normal, right? Your blood pressure, it means that your heart requires minimum pressure for it to push blood to where it needs to go to. For instance, in the case of sex, your penis, right? But then in the case of when the person is having a heart disease, it means that the heart has to make more efforts to push blood to get to the penis. And then in trying to do that, it can begin to fail. And that is why most of the reasons why men die during sex is heart attacks. They have a heart attack. Oh, daddy, come. He's trying to pump the heart faster, and then before you know it, the battery is dead.
Inactive service.
I hope we all understand. I hope I'm getting somewhere with this, right? So that is why, if there is the first thing that I need any man to check your heart first. And for anyone that is 50 years and above, I think on a yearly basis, you should be doing it. You should be checking your heart from time to time. Another thing that would really help you, again, is exercise. Healthy exercise. Brisk walking for 30 minutes will help you, right? Lifestyle changes too. You need to start from anytime from 50 upwards. You need to do a review of your diet, right? So you can do a dietary review. Oh, instead of taking so much fries, I'm going to cut it down, right? You cut it down by 30%, cut it down by 50%. I will not take so much of fried stuff. I'll cut down the salt in my diet. Some of those things are things that you need to do. The best thing to do it for all the men here is to also speak to a dietitian, somebody who is in diet, and tell you that I'm getting to 50. What are the things I should start eating now? And then you put that into context and start working on it immediately. I would even advise that men that are in their 40s, anything from 45 and above, start practicing it. Because by the time you're 50 and above, it will become a habit that you find it difficult to let go. right? So your heart is one of the single most important things I will ask you. Then also monitoring your weight, because many of us, you are a big man, right? You are, most times you are giving instructions to people, you are talking to them, you are telling them. Before, you know, when you are my age, you are walking about, you are hustling. But when you have gotten to a point, right, you start adding weight and you don't know, because they will say that I'm a big man now, you need to show it in your body. But in doing that also, you are putting yourself at risk of certain things like heart disease as well. So your weight is something you must put in check. You see, pot belly is something that we should look at as one of the few things that put us at risk of dying early. So because that fat in itself is a risk factor for certain cardiovascular or heart problems. So what is my advice? Activity. And it's not until you lift weight and, no sir, you don't need all that. You just need to be active. That is all. You need to be active. If you, for instance, you set timers where, as we have been here, you make sure that you stand up for 30 minutes after you have been sat down for at least 90 minutes, like 1 hour, 30 minutes. You stand up and you take a walk a little bit. You come back again and you sit down. You can do this for your activity. You can do this for yourself in your offices. Please always take a break, because some of us, when we enter our offices, we get to the office and we just sit down. And so many people are coming to see us, they are coming to consult with us, and you are not even taking that time for yourself. You know that, this one is for me, I need to take a break. And you stand up and take that walk. That walk, by the time you put it together in a year, it will save you from a lot of problems, including your heart. So, a visit to the cardiologist every year, if for anyone who is planning to be sexually active from their 50s and above, is sacrosanct. It is something that I would not ask you to play with it, so that you can know the state of your heart at every single point in time. And the next thing that I would also like to share is also for diabetes as well, because diabetes might not show you that it is there until it is late. So, and diabetes too is one of the risk factors for heart problems as well. So, if you're somebody who is active in, sexually in your 50s, check your blood sugar as well. Know those numbers. It is important to know those numbers. For instance, if somebody asks you, if I ask you, sir, please, what is your blood pressure? You should be able to tell me, my working blood pressure is 120/80. Every single one of us here should know your blood pressure. Your blood pressure when you wake up, your blood pressure when you are having an activity, right? And your blood pressure when you are at rest or just there. So, and if those things are not correct, use medications, use your lifestyle to bring that blood pressure down, so that you can best sustain yourself when it comes to your sexual health. I hope that answers the question. Thank you.
Thank you.
Already 5%. Is this for child now?
Speak to us the correlation between sex and prostate cancer.
Okay. So to directly answer, there is no deep research that has linked those things together. And there is still possibility that even if you are celibate, there is a possibility, even if you are not celibate, there is also a possibility for you to develop prostate cancer. In fact, any man from 50 years and above is one of the tests I wanted to talk about, although there is no direct effect to your sexual health. But then, one of the tests you must do as a man is PSA. You must do a prostate-specific antigen test and a prostate check. So the problem that we have for men in when it comes to prostate check is that, number one, we don't like going to doctor. Number two, when you get there, the way they will check your prostate, you don't like it. So let me explain. So because you will not want a doctor probing his finger through your anus. I mean, it's just once a year. But then I would recommend it to everybody. In fact, I would recommend that all men that are here in this room, if you've not done a colonoscopy, right, this year, and you are 50 years and above, please go and do it. Colon cancer is one of the very common cancers right here in Nigeria across. And because we've been having changing diets, the things that we eat is not what our forefathers used to eat before. most of the, if I ask any one of us, have you eaten something that has been from a pack this last week? You most likely tell me yes. Thank you very much. Thank you very much. And thanks Monchito, but then we understand that our diet is changing. So let me go to the question, then I will expatiate again. So there is no direct link between sex and prostate cancer. However, for all men, it is important that when it comes to your prostate, you need to also know the health of your prostate. Men are more at risk of prostate hypertrophy. That's BPH, benign prostate hypertrophy. It's not linked to prostate cancer. It's a different type of condition. But then it's a condition that can also affect you and your health, because the man will be struggling to urinate. That's one of the things that starts happening, and then before you know it, he starts having some urologic conditions like uropathy, and he starts having urinary incontinence. Is urinating when he's not supposed to urinate, all those things like that. And so those are the things that we need to look out for from old age. So a prostate check is also very important. So check it at least once in a year. Just check. If you have a normal prostate and they told you that nothing, you can do it in 2 years' time, right? If they said that there is nothing, no enlargement or anything, do it in 2 years' time. For anyone who is 50 years and above, right? You don't need to do it on a yearly basis. You can skip. So if, for instance, you're 50, they tell you that your prostate is okay. Do it when you are 52 or when you are 53 and check again. Do you understand? So, but then when it comes to sex, it has not yet been shown that ejaculation can prevent prostate cancer. No. There are still cases, because if I tell everyone that that's what happens now, you want to be doing that, and then you will forget that you need to check your prostate. Do you understand? Yes. So realistically, there is no direct clinical proof to it. There is a hearsay that it is. But then my own advice is that a man in old age should still be sexually active to a certain extent when they approach old age. It's not this is all part of, we've established it by answering the question that sex is a form of exercise, right? So, and forget all the nuances that we put to sex. It's healthy. It is healthy. So when done in a healthy manner and within the right context, it is healthy. So I would not advise a man to stay away from sex. That in itself is even unhealthy, because it can affect you, affect your mental health, and put you at risk of things that that might mentally put you in the wrong path. So I hope that answers your question. Yes, sir.
My son falling, but it is not falling to me.
Yes, sir.
What can I do to reduce this my problem?
Okay, sir.
Is it medication or exercise?
I will say, sir, exercise. And if there is any underlying condition, for instance, I need to establish it that for us Africans, hypertension is our thing. We cannot escape it. Right? We can't escape it. So the plan is exercise. Then, sir, diet. By now, if I look at your plate, right? For, let's say you want to eat a bar. The plate, that plate, eba should be 30%. Vegetable should be 70%. But most times you know that we men, the swallow will be 60%. So another thing that we need to do is how we eat matters. What we eat matters. Now, I will tell you this for free. Nigeria has one of the best soups that can regulate blood pressure in the world. You can take my word anywhere. You can check it. Whether you are eating okra, you are eating ewedu, you are eating egusi. You see those leaves? They are very good and they help your health generally, right? But then it is how we eat it, how we cook it also that matters. One of the things that you can do is that when you are 50 and above, you can tell madam, Please, so help me to reduce that oil. You should see the vegetables when you are eating it. Efo is a very strong, it's one of the best soups that we have. When it comes to soups that are healthy, you should be eating more of that, right? I would advise that you also switch to seafood, like protein, like fish, croaker, all those type of fish. Apo, I love apo very much. I love this fish, panla, egg. They are all very good types of fish that you can eat. Those oils are also very good for your heart. You see, the omega-3 fatty acids that are in fish, they are present in fish, they are very good for your heart. So, sir, if you eat those kind of foods, I can expect that in a few months, you will not recognize your body again. Then also, exercise. Cycling, sir, is a very good. Skipping is okay. Cycling is very good. Walking is very good. Okay? And then you can do this morning sit-ups. Very helpful. You can do it. When you want to start, you can start with assistance. And then later on, you can perfect it. And you don't need to do too much of it at once, sir. Just start with a little. You can do 10, right? Take a break for 15 minutes. Do another 10. Take a break, and that's it for the day. The next day, you try it again. And when you are doing that with your diet, also changing your diet, you will notice that it's going away. I hope that answers your question. All right. So
that should be our last, please.
Okay, let's like take two questions together and we just wrap it up.
Please, because I have one or two.
All right.
Other people that have to still come up here.
Sir, please.
Yeah, Mr. Kachi, yeah, go ahead.
Don't worry, I will be able to hear you.
Now, this is mental ability. You also think that maybe assimilation what suggests in terms of assimilation, reading, environment affect your mental ability? For example, now there's 100 million here. People might think that will have your men because they need to also suffer. So all those also affect mental in terms of money, breathing, all those things as well. Then secondly, I was watching a show by the Ghanaian doctor. So they were just like a show like this. We were asking him that he said that building sex to prostitutes is up now. He said the regular sex you have, it helps you to keep your prostate alive. So that arose a lot of controversy. Are you saying that having said it's not even habits even in a month, it's not a way of brings the man. And now, okay, when it comes to that, celibate, what advice would you give them when they have been celibate for 10, 20, 30 years? So what happens that also? That then thirdly, in terms of health, when it comes to men, because I know health also matters about men. So what advice do you actually give in terms of because very speaking, to get sick is very, very cheap. To get better in this country.
Yes.
So now, what do you actually advise? Because health in Nigeria is very, very expensive. Not like abroad. So what do you recommend that is actually help you that avoid that kind of risk of setting food that will damage?
Thank you very much. Okay, so I think these are very good questions for me to end this session. So you talked about spaces for men. So I will say this without any bias. Men, please, I know that you take care of people, but please spend time, spend money to take care of yourself. I will say it again. Please, men, I know that you take care of people and so many people look up to you. But please, take care of yourself first. The reason why we are saying this is because today's culture has tried to push men to the back seats as if we are not important. But I would say that every great society has been built with men. So it is very important that taking care of yourself is a guarantee that tomorrow will be better. If this country will be better tomorrow, it is because we have better men. So sometimes helping yourself and treating yourself can just be a kind thing. You know, many of us are like that. We will wear one clothes. I don't know how many of us do that. One clothes, they will beg you to change your wardrobe. How many of us has deliberately changed our wardrobe this year? That you went to go and shop as a man that I want to buy clothes. One, you see, there are few of us that are doing that. And that is the reason why I am talking actively and begging. Because when we want to talk about mental health, right, we are looking at the pressure that men face. But sir, I want you to raise your hand here. How many of you have bought something for somebody this year? Your spouse, your wife, side chick. Thank you. Do you see what I'm saying? Please, I want to use God to beg our men. Take care of yourself. Spoil yourself. Sometimes you don't need to go to hotel because of a babe. Carry yourself. Go to the hotel and treat yourself well. Go to a resort and just go and enjoy yourself. Yes, who is saying doctor here?
Razor, doctor.
Please, you should be able to take care of yourself. You should be able to know what it is to treat yourself nice. Sometimes buy that new phone, not because you have the money to spend, but because you need to know that you are caring for yourself. Are we following? It is very important, and I'm saying these things because it is for us to be able to take care of a nation, to take care of people, and to be responsible for people. We should be able to take care of ourselves first. It is very important, and it also appears to food, because sometimes you will see men, they will not eat, but their children, their wife, they will eat. But then when you look at the man, you'll be like, But because everyone will just be like, no, don't worry, it is well, it is fine. Sir, take care of yourself, right? So, and the second question that you mentioned, please, can you mention it again? Okay, the one about sex. Like I said at the very beginning, there is no link between that, because if that was true, then all the men who are celibates in the seminary would have prostate cancer, but that is not the case. So you see that is why I said at the very beginning that there is no clinical ground to really back it up like that. But then I will still say it, that sexual health is still a part, an important and a critical part of men's health that should be taken seriously, right? Then you mentioned the next question that you talked about was about, how can we take care of our health now that health is expensive? I will say this again, if you are taking care of yourself deliberately, it will not be expensive. So what I mean by that is, okay, let's do by showing of hands. How many of you have health insurance in this room? Okay. So that is one of the reasons why I do what I do, because health insurance is not only cheaper, it helps you to subsidize things. If to say you have an emergency now, can you just bring out 500,000 to pay for the bill? That's one of the things that are also affecting us mentally as men, because we have to cough out money when it is even highly, when it could have been prevented. So health emergencies should be something that we as men should be proactive to work towards. So if I'm to advise, as we are here, you look around, pick up, in fact right now, there are health insurances for 100K in a year for you that will take care of your health, anything that has to do with your own health issues. There is also social health insurance by Lagos State, Ogun State. I champion awareness for the Ogun State health insurance. 12,000 in a year, and you can be able to visit any hospital for checkups in Lagos or Ogun State. If you are doing the one for Lashma, there's that one, Ilera Eko, that's what they call it. There's another one for Ogun State. 12,000 for a family of 4, I think it's about 40,000 thereabouts. So even if you don't have the big money to pursue a private HMO, do the social one first, so that if any emergencies want to arise, you have already taken care of it to a certain level. It will only require maybe minimum effort to add small extra money, and it will not have to be tasking, right? So a way to prevent that kind of thing happening is by ensuring that you take care of your own health by being proactive. That's the word I was looking for. By being proactive, by anticipating things, because as men we are leaders. So the ability to anticipate things or see things before they happen is one of the qualities of men. So what I would advise is that for every one of us seated in this room, let's try as much as possible. It is not until the emergency happens that you now be looking for money to pay for it. No, you anticipate it. You let your family know that I've settled health insurance. So if any one of you are sick, just go to any hospital, it has been settled, you'll be taken care of. And there are a lot of them. You can look out, if you are looking for health, like HMOs, the private ones, I would recommend Leadway, right? You can look out for that one. For the public ones, I would recommend, if you are in Lagos State, do the one for Lagos State. That's the social health insurance by Ilera Eko. And then if you are in Ogun State, you can do the one for Ogun State health insurance. They call it Oxshire. So you can do those ones, but then the general perspective is that we need to be more proactive when it comes to our health, so that we can live long and live happily. Thank you very much.
Please let's put our hands together, please. Please, if you are clapping, clap.